Hi, welcome back to your prescription for medication education. My name is Yenmi, and today I'll be continuing the enteral dosage forms topic. In my last video, I had covered solid oral dosage formulations. Today I want to move on to liquids. So liquid dosage forms are medications that are in a liquid medium. These include suspensions, solutions, elixirs, tinctures, emulsions. These are easier to swallow than solid dosage forms, and they also offer faster absorption than our solid formulation alternatives. A solution could be defined where at least one substance, termed the solute, is dissolved in another substance, termed the solvent, to form a homogeneous mixture. I've listed here a couple of the most commonly used solvents. We have purified water. Purified water only has about 1% of dissolved solids when compared to typical tap water. We have ethyl alcohol. In order to meet USP standards, it has to be between 94.9 and 96% volume in volume. We have dehydrated alcohol. We have diluted alcohol, which is basically just equal volumes of alcohol and purified water. We all have rubbing alcohol. This is usually at a 70% concentration. We have glycerin and propylene glycol. Strengths for solutions are often notated as weight in volume and percent volume in volume. A percent weight in volume is the number of grams per 100 ml. So that means a 5% weight in volume equals 5 grams of medication in 100 mLs of the actual product volume. The percent weight in weight is the number of grams in 100 grams. So 5% weight in weight means there's 5 grams of medication in 100 grams of product, and a percent volume in volume is the number of milliliters in 100 mLs. So a 5% volume in volume means there's 5 milliliters of medication in 100 milliliters of the product. Syrups are concentrated sugar or sugar substitutes in an aqueous base, meaning our liquid formulation is going to have water in it. Some examples of typical sugars that are in syrups are sucrose, sorbitol, or glycerin. There usually is a high concentration of sucrose, which helps limit microbial growth. Syrups can either be medicated or non-medicated. They're useful because they help mask unpleasant taste. They do this by limiting the contact of the drug on our actual taste buds. They do sometimes contain minute amount of alcohol, or sometimes they contain no alcohol at all. Syrups are often prepared with colorants or flavorants as well. Elixirs are clear, hydroalcoholic solutions that are sweetened. They're typically less sweet than syrups are, and as the name hydroalcoholic implies, they contain both water and alcohol as the solvent. The alcohol content will vary from product to product. Elixirs that typically have an alcohol content somewhere between 10 and 12% usually don't need to have preservatives added to them. Although elixirs are typically clear by definition, most products do have coloring agents added to them. It's important to keep these products away from heat as well. An interesting side note, although the prescription strength medications can have varying amounts of alcohol, over-the-counter products are limited. The FDA limits alcohol content to 0.5% for products that are intended for children under 6 years of age, 5% for children between the ages of 6 and 12, and 12 and older, the alcohol content can be limited to just up to 10%. So again, that's just for over-the-counter limitations. Tinctures can be defined as hydroalcoholic or alcoholic solutions of a medicinal substance that is extracted from vegetables or chemicals. Their alcohol content can range from 15 to 80%. This helps limit microbial growth. And again, for these products, it's important to keep them away from heat, and they're usually stored in a light-resistant container. Suspensions can be defined as drug particles that are distributed throughout a vehicle. The suspended particles are termed suspensoids. This allows for drug manufacturers to make drug formulations that would be unstable if they tried to make them as a solution. Some formulations may require reconstitution. If that's the case, they'll have the words "for oral suspension" listed on the bottle. Just like syrups, they're useful because they help mask the taste of medications. Most particles in suspensions are in the range of 1 to 50 micrometers in size. They do require agitation prior to administration due to settling. Flocculating agents are added to avoid compact caking on the bottom of containers. Caking can create particles that are larger than originally formulated even after shaking. Suspending agents are added to thicken the dispersion medium. Some of these suspending agents can be carboxymethylcellulose, xanthan gum, or polyvinyl pyrrolidone, also commonly known as just simply povidone. Liquid emulsions are small globules of liquid distributed throughout a vehicle. Essentially, this is a liquid within a liquid. They can be used for oral, topical, or parenteral reasons. Emulsions are considered to have two phases. The small globules are considered the internal phase, and then the dispersion medium is considered the continuous phase. Oil and water emulsions are described as the internal phase consisting of the oleaginous component and the continuous phase consisting of the aqueous component. Water and oil emulsions are described as the internal phase being the aqueous component and the continuous phase being the oleaginous component. They often require an emulsifying agent. This helps reduce surface tension between the two phases, which allows for mixing. This helps prevent total separation, which is termed breaking, which basically allows the internal phase to continue to be distributed throughout the continuous phase. Examples of emulsifying agents include sodium lauryl sulfate, benzalkonium chloride, magnesium hydroxide, and aluminum hydroxide. Emulsifying agents have hydrophilic and lipophilic properties. Most agents will lean in favor of one of the two properties. They're assigned a hydrophilic balance, which is a value between 1 and 40. So the higher the value, the more hydrophilic the emulsifying agent is. So using a hydrophilic agent will aid in the development process of an oil and water emulsion. Just like suspensions, they require agitation prior to giving the dose. The internal phase may either rise or fall depending on its density to the continuous phase. Again, emulsifying agents are important because they help the prevention of the emulsion from breaking, which is often permanent. Suppositories are solid dosage forms that are molded in a base and shaped to facilitate their rectal administration. They're usually finger-shaped or bullet-shaped. They are solid at room temperature but will melt or soften when inserted inside the rectal cavity. Their typical length is about 1.5 inches, but about half of that for children. When we see the word insert, this also refers to a solid dosage form that resembles a suppository, but when they are given through the non-enteral routes, such as the vagina, then they're termed inserts. Some of the benefits of the suppositories are that they have limited first pass effect, they avoid the acidic environment within our stomach, they have a much quicker onset than the oral administration, and they're useful for patients who can't swallow or are having severe vomiting. Some of the downsides of suppositories include the expulsion of the suppository via defecation. There is a much smaller surface area in the rectum compared to the small intestines, and the unintended migration of the suppository higher in the rectum. If a suppository migrates too high, so if it enters the sigmoid or the descending colon, then the superior rectal vein will carry the drug to the port of circulation, causing more first pass metabolism than we initially wanted. Suppositories are made of a couple of different bases. They can be either made of oleaginous bases, which is a fatty base, usually out of cocoa butter, which melts easily. These usually require the suppositories to be stored in the refrigerator, or they can be made out of water miscible bases. These can be glycinate gelatin or polyethylene glycol, which slowly dissolves, or they can be a mix of both oleaginous components or water miscible components. As healthcare providers, we can give some counseling points for the administration of suppositories. We should inform the patient that they should lay on their left side. This allows for easier administration and reduces the chances of a vagal response from occurring because it aligns with our body's natural colon angle. We should make sure that the suppository is removed from the wrapper. The patient can apply a small amount of water to the suppository for lubrication. When they're going to insert the suppository, they should angle the suppository towards the umbilicus. What this does is that it allows for the suppository to make contact with the rectal mucosa and helps avoid accidental contact with feces. The suppository should only be inserted about 5 centimeters from the anal sphincter. Afterwards, they should hold their buttocks together to make sure that the suppository stays in place. Lastly, They should stay in this position for several minutes to make sure that the medication has time for absorption. So this has been your dose for prescription for medication education. I hope you enjoyed today's topic. Please like and subscribe, and I really would like some feedback. What don't you like about it? What do you like about it? Any sort of changes that I can make to make sure that you are learning as much as I am throughout my presentations. Anyways, thank you and have a great day.